Okay, what about fungal infections? So when we're talking about fungal infections, the term is mycoses. So just see mycoses as fungus, okay? And they're typically divided into superficial infections, such as on the skin, in the mouth, such as thrush, or vaginal infections, such as a yeast vaginitis. And then there's deep fungal infections um, affecting organs in the body, such as the lungs or the brain. Okay, so fungi, such as yeast or molds, uh, are often considered normal flora in the body and on the skin. Okay, so when they're colonized and not causing any disease, they're just considered part of the normal flora of the body. Okay, fungal infections are definitely not as common as bacterial infections or viral infections. Uh, if you were to get a superficial fungal infection on your skin, say, because you've been sweating a lot, it's been a hot summer, um, and you develop a fungal infection in your groin or between your toes, those are very easily treated with topical antifungal medications, just creams, right? Deep fungal infections, such as in your lung or in your brain, usually signify that there's something wrong with the immune system that has allowed the patient to get such a serious fungal infection in the first place. Okay, so superficial fungal infections that I mentioned before, they're called dermatophytes, so derma, skin, um, and we call them tinea. So tinea crurus is in your groin, tinea pedis is on your foot, tinea corporis is on your body, and tinea capitis is on your head. So it's just a superficial fungal infection of a part of your skin. Okay, easily treatable with topical antifungal medications. They love warm, moist areas, such as the groin, under the breasts, between the toes, in an infant's diaper. Those are all areas where tinea can flourish, or yeast can flourish. Okay. Um, when we're talking about yeast infections, say in the mouth, such as thrush, they're usually caused by antibiotic use or by cortisone inhalers. So we use cortisone inhalers for asthma. How do they cause thrush in the mouth? Well, cortisone inhalers deposit part of the medication at the back of the throat, and cortisone suppresses the immune system, and so it allows the yeast to grow, okay, and you develop thrush. In terms of yeast vaginitis, the most common cause is the use of antibiotics, allowing yeast to overgrow in the vagina, leading to the symptoms of a white vaginal discharge. Okay, and women often come in after having taken a course of antibiotics with yeast vaginitis. Deep fungal infections. Here's an image of a lung with a fungal infection in the right upper lung, and these need to be treated with oral antifungals, which are typically pretty toxic medications that you'll hear about in pharmacology. Okay, let's go on to parasites a bit. So a parasite is an organism that obtains some kind of benefit, usually survival, from infecting its host. Okay, they're typically spread by food or water, contaminated food or water, or some kind of a vector, such as a tick or a mosquito. And when we're talking about parasites, they include protozoa and they include worms. Okay, and worms are usually gastrointestinal worms that, for the most part, infect children, because children put a lot of things in their mouth that can contain the worm, or at least the eggs of the worms, to begin with. Okay, so let's go to protozoa first. So these are just unicellular organisms, just like bacteria, and they feed on organic matter in you or on you, such as dead tissue. So an example of a protozoa is malaria that you'll acquire through an insect, a mosquito bite. Giardiasis is an infection that you typically get from drinking contaminated water, dirty water, and you get gastrointestinal symptoms of diarrhea, abdominal pain, loss of appetite. Trichomoniasis is usually an STD, so women get a foul, kind of fishy odor, vaginal discharge, and that is often called trichomoniasis, and that can be treated with an anti-parasitic medication. Okay. There's other ones as well: body lice, head lice, scabies. We'll talk about all of these as the modules go on, and they're all different forms of parasites. Okay, when we're talking about worms, we use the term helminthes. Okay, worm parasites, and they're common in underdeveloped countries, but they definitely exist here in North America as well. Okay, and if you look at the ones on the right, by far the most common ones, especially in children, are pinworms and roundworms. Okay, and often parents will notice the pinworms in the stool. They'll be moving around in the stool of the child. A roundworm is a bit bigger. It's more concerning when the parent sees a roundworm, but pinworms are also upsetting to see, and they're very obvious. They're little white worms that are moving around in the stool. Okay, so they live within the intestine of the human. Very common in children because of their interest in sampling soil, sand, having dirty hands that can introduce the worms into their gastrointestinal tract. By the way, pinworms and roundworms are very easily treated with a worm medication that you'll learn in pharmacology called mebendazole. Okay, so just to alleviate any concern about seeing worms in a child's stool, they are actually quite treatable. Okay, so this is just a slide showing you some common parasites and their vectors. So top right hand corner, so Plasmodium is the actual parasite that carries that we call malaria, and it is spread by the mosquito bite, right? So if you're in an area that has malaria, you're likely going to take anti-malarial medications to prevent Plasmodium from taking hold in your body and causing the disease malaria. You're going to use insect repellents on your skin to prevent the mosquito from getting onto your skin and biting you to begin with. And you're likely going to be sleeping in a bed that has a net around it to prevent mosquito bites. Okay, so there's prevention and there's also treatment of malaria. Okay, so the bed net, the mosquito repellents, the the preventative medications that people take when they go traveling, that's all to avoid getting malaria. But if you do acquire malaria, there's medications to treat the malaria as well. Lyme disease is caused by a little parasite called Borrelia burgdorferi. What an amazing name. I don't think you need to memorize it. I just think it's a pretty cool name. And it is spread by ticks, right? So the tick attaches to your skin. It introduces this little parasite into your body, and it creates Lyme disease. And the most common symptom of Lyme disease to begin with is an expanding rash at the site of the puncture, where the tick punctured your skin. Okay? And we call that erythema migrans. Erythema means red, migrans means migrating, so it's just a migrating, expanding red rash. Okay. So is there an image of Lyme disease? Yes, there's an image of an engorged tick. So the tick attaches to your skin. It feeds on your blood, which then allows it to introduce Borrelia into your bloodstream. Okay. Body lice and head lice. That's pediculosis, right? And that's just from direct contact with someone else who has head lice, and now it's in your hair. Okay. Scabies. That's from a little mite that burrows under your skin, and the female lays eggs in your epidermis, and it's incredibly itchy. Okay. Head lice is very itchy too, by the way. Scabies goes all over the body. It loves to be between your fingers, at your wrist, under your armpits, in your groin. So another parasite that you'll learn more about later in the modules. Giardia we spoke about, and amoebiasis. So giardiasis and amoebiasis are intestinal parasites that are spread by contaminated water. Say, for example, you go for a hike in the woods and you decide to drink from a pond or a contaminated lake. If you have intestinal symptoms a week or two later, it's likely going to be from giardiasis or amoebiasis. Okay. Okay, so let's just go through the stages of a disease. So the first stage is contact with a pathogen, whatever it is, whether it's a virus, a bacteria, a parasite, or a fungus. And then there's an incubation phase. So the incubation phase is where the pathogen has entered your body and it's setting up shop and it's replicating, but you don't have any signs or symptoms. And most infectious diseases have an incubation phase, right? So if you're in contact with someone with, say, chicken pox, it's not like you're going to get chicken pox the same day. It might take a week or two for you to develop the disease of chicken pox, even though you've been infected and you're incubating the virus. Okay? Followed by the prodrome. The prodrome is just the beginning of the signs and symptoms. Maybe a bit of aching, a bit of low-grade fever, a bit of loss of appetite. Those are prodromal symptoms. Followed by the acute infection. So this is the stage where the maximum impact of the infection is now taking place. The damage to the tissue, the inflammation in the body is at its maximum. Okay, so an example would be, say, a pneumonia, right? So the prodromal phase was where you just started not to feel well, a bit of low-grade fevers, maybe a slight cough, but then a few days later you have the acute infectious process, so acute pneumonia, where you're now short of breath, very ill, weak, coughing up sputum. That's the maximum part of the disease, the acute stage. Then you have the convalescent stage, where the pathogen is now being eliminated, either from your immune system, which is the most common way, or with assistance by the use of, say, antibiotics. And the tissue starts to repair itself, and the signs and symptoms begin to resolve. So convalescent phase. And then finally, resolution. The pathogen been completely eliminated, and your tissue or the organ that was affected has healed.